I think what's valid is to say WHO is soft on its member states and that that is by design. The member states have chosen to set up the organization that way. You know, I what is always a little bit ironic about the accusations from the Trump administration that WHO is soft on China is that I think if you look at how they've engaged with the US, you'd also have to say they've been soft on the US. You know, the US has been one of the worst performers, arguably the worst performer in the world in containing COVID. Certainly, we have the most number of cases and by far the most deaths. Um, there has not been a word of criticism from WHO aimed at the United States and our mismanagement of this outbreak. And again, that is how member states have chosen to set WHO up. The member states have chosen to establish the WHO as a an institution with strong technical capacity and no enforcement capacity. And if we, if the world wants WHO to have those capabilities, I think that's a fair discussion to have and probably one we should have. But that isn't the way states have chosen to establish WHO now. I think where the Trump administration gets it badly wrong is first in assuming that this is unique to China, which it isn't. It is it's a dynamic between WHO and any member state. You know, WHO was very deferential to Guinea in 2014 or to Democratic Republic of Congo in 2018 as well in ways that I think sometimes went beyond what we would want to see. And those are not powerful member states. Those are not politically powerful countries. They're not major financiers of WHO, but that is how the institution has been designed to operate, and that's how it operated. But I think it also, the other thing the Trump administration seems not to realize is a WHO that is tougher on China would be a WHO that is also much tougher on the United States. And maybe that's a good thing, but I don't think that's what they have in mind.